Hello viewers, this is Dr. Kota with the Kota Metabolic Institute. I'm going to be discussing a very important topic today that most of us are encountering in today's world, which is inappropriate or disproportionate or excessive usage of pharmaceutical interventions on a chronic long-term usage basis. So this has become a main issue whereby it starts with mostly treating from a symptom-based perspective and treating the symptoms, or a condition-based perspective, treating conditions that we name, and in the process it leads to many complications from those medications, be it anything that we try to do for any condition or any symptom when used over a period of time or chronic usage. So, and when that happens, instead of trying to prevent the condition or the problem, or instead of trying to address the root cause or the underlying condition, we end up giving these medications, and it turns out that it leads to complications, and we are trying to busily manage those complications that arise from giving these medications on a chronic basis. I'm not against the usage of medications. I would like to use the medications, or any physician would like to use the medications, or to that extent any patient would like to use those medications only when needed in acute situations, urgent situations, emergencies, or in subacute situations during the transition from getting very ill to slowly getting stable and then going back to normalcy. However, there are some conditions that we know that have to be treated with medications, and we have less choice. So the biggest issue today that I am going to talk about, I will be addressing commonly encountered situations in our practice here, which is weight gain because of medications. The same thing can happen in many practices outside there, where your glucose can go up because of medications, your blood pressure can go up because of medications, your weight can go up because of medications, cholesterol and triglycerides can go up because of medications, though they were intended to treat some other condition. So it is very crucial for the caregiver, which is a physician, and also the person who's getting the care, which is the patient, to address this issue and discuss the risk and benefit, the safety, and thereby have a plan in a shared decision making way to really see how to taper off the medication if needed to be given. And a lot of times I'm going to be mostly addressing the issue about weight gain that can happen in present days population and treatment patterns that we see. About 25% of the medications that are used for adult pharmacotherapeutic intervention can cause weight gain. That's a big number. So I will be listing a few categories of weight gaining categories, the medications that are commonly used, and we will be going into the details and specifics of those lists individually down the line when we talk more. So commonly encountered, if we see people who are going for chronic usage of antihistamines, so antihistamines that are used for colds and allergies over the counter, chronic usage can cause weight gain. Similarly, antihypertensives, that medications that are used for high blood pressure, which belong to a category called beta blockers, or sometimes some specific classes called calcium channel blockers, can cause weight gain. Very similarly, anti-diabetic medications can cause weight gain, and very much so anti-inflammatory and medications used for decreasing the immune reactions of the body like steroids can cause weight gain. Very much similarly, there are also medications that are used for anti-anxiety on a chronic usage can cause medications. Antidepressants can cause weight gain. Antipsychotics can cause weight gain. Medications used for schizophrenia and bipolar disorder and all these medications can cause weight gain. And also very much similar, there are many other medications like these kinds of class of medications which can cause weight gain, and patients come to us with this secondary complication. And at that time, it's very crucial for patients as well as the physicians to recognize that if we can replace those medications with weight neutral medications instead of causing weight gain, and also maybe in some cases weight loss that can be caused by treating the same condition, if we have to treat the condition with the medication, will be more effective. And this should be discussed between you and your physician, because these are important. Because how it works is, some of these medications can increase your appetite by working on the brain, increase your appetite by working on the gut, which is connected to the brain. They can make you more depressed, and depression itself will make you gain weight by eating more and increasing the appetite. Or they can also cause decreased energy expenditure and cause weight gain. So this is a vicious circle, and we'll be chasing our own tails unless we address this important problem of weight gaining medication side effect that most of the medications do, and address this as a top priority. I will be coming back and talking to you about each individual class of these medications down the line very soon. Until that time, take care of yourself, because you're very important.